Hey everyone, so today we've got a very quick presentation on some drugs for gout. Now you may have heard of gout, you may know someone with gout, or you may be asking me, what is gout? Let's get started. So what is gout? It's a form of arthritis that's characterized by sudden, intense joint pain and inflammation. So when you normally think of arthritis, you might think of this sort of dull, aching pain or these flare-ups. With gout, it's very acute. It occurs suddenly, usually at night, and it very often affects the big toe. So look at the big toe right there and notice all that inflammation that is building up right at the joint right there. Now, the first 4 to 12 hours of a gout flare have the most severe pain. It's this burning, shooting pain. Oftentimes, even just a breeze on the foot might send someone into this very severe pain. So it's caused by an accumulation of what are called uric crystals in the joint, and that causes intense pain and inflammation. What are uric crystals and what are they doing in the joint? Well, uric crystals they form after high levels of uric acid are present in the blood. So uric acid gets deposited in the blood after eating certain foods. So when you eat certain foods that are high in what's called purines, those purines break down into another chemical called uric acid. If that uric acid in the blood is too high, it aggregates, it collects in the joints, and these very, very sharp crystals interact in those joints, and they can cause that severe inflammation and severe pain. Now, foods that might cause excessive uric acid buildup are the foods that you want to avoid if you are predisposed or have gout. So that includes organ and red meats, so especially liver, seafood, and alcohol, especially beer. Those are all very high purine foods. So what we like to do for our patients with gout is put them on a low purine diet. So we want them eating more fruits and veggies, whole grains, some low-fat dairy, some legumes, some beans, or some nuts. We want, again, less shellfish, lower consumption of organ meats, especially liver, stay away from beer and other alcoholic beverages, as well as soft drinks. Now, to treat and prevent gout, we have two main medications. Now, for acute attacks in gout pain, the first thing that you really do are your NSAIDs, your non-steroidal anti-inflammatory drugs. So those are our ibuprofen and naproxen and others. Corticosteroids can also be used, like prednisone, so those reduce inflammation. And colchicine is one that's specifically for gout. Now you'll notice this beautiful flower right there. That's autumn crocus. Colchicine is actually synthesized from that flower. So that's why I included it, because it's one of my favorite medicinal plants. Now, colchicine or Colchris is an anti-inflammatory drug, and that decreases gout pain and other arthritis-related joint pain. And it's available in tablets. Main side effects of it are nausea, vomiting, and diarrhea, but generally it's quite well tolerated. Now, there are other drugs that are used to reduce the risk of gout-related complications. So colchicine and NSAIDs and corticosteroids are good if you're having a gout flare actively, but if you want to reduce your chance of having one, then we put you on allopurinol or Alloprim or Xyloprim. Now, Alloprim, Xyloprim, allopurinol, they work as a xanthine oxidase inhibitor, which essentially limits the amount of uric acid produced in the body. So if we're able to limit the amount of uric acid that we create in the body, that stops it from building up, and that stops it from collecting in the joints and causing that gout pain. Now, it's available as an injection, which, of course, I mean, when you're talking about arthritis and something is already painful, do you really want to inject that joint with it? I mean, maybe, but most of the time you see allopurinol as tablets, which you can look at and see right there. Now, side effects with allopurinol, although it's generally very well tolerated, they might include fever, rash, and liver or kidney toxicity. So just things to be aware of, but generally allopurinol is quite well tolerated, and it's very, very essential for people who have gout and do not want to go through those painful flare-ups again. So that's all it is for gout. And as always, if you have any questions, feel free to contact me.